like so many interpreters that I have met over the years, I started out without actually choosing it because I was the interpreter for my family. And then I thought I was going to do something else when I went to college. I flirted with, being a biomedical illustrator because I'm creative and I like to draw. But I also liked learning all the medical terminology. And then I started teaching, tutoring for literacy, adult literacy, which pulled me into teaching English as a second language. And my first job when I graduated from college was as a Spanish and Portuguese interpreter, even though I told the people hiring me, look, I've lived in Mexico as a child. My stepmother is Spanish speaking, but I don't know Spanish grammar. I know I would never write something in Spanish because it would be full of grammatical errors, and so I shouldn't really be a Spanish interpreter. I have studied Portuguese. I have a degree in Portuguese. I should just be a Portuguese interpreter because I have native um, fluency in both English and Brazilian Portuguese. And they're like, nah, it's okay. So I got hired for a language which I myself knew I spoke and understood, but not at the level that it should be for a professional interpreter. I myself recognize that. Unfortunately, one of the interpreters on the team who was from Chile had difficulty with the accent on Portuguese for people who come from the Azores, which is much stronger accent on the Portuguese. Think of like a Scottish accent on English. The difference between Brazilian Portuguese and European Portuguese is more like the difference between the English spoken in New York and the English spoken in London. Different accent, but really very similar with a few vocabulary words different. Now, when you go to Scotland, sometimes you might not understand what they're saying, but if they write it down, it's still the same words, the same alphabet, and you can understand each other. So that's how this Chilean interpreter felt when she was trying to interpret the Azorians. So without our supervisors knowing, we would swap our assignments out, and I would give as many of my Spanish to her, and she as many of her Azorian to me as possible, because we wanted to provide the best quality interpreting that we could, even though our management, who only spoke English and had never traveled outside of the US, weren't all that concerned. They had ticked the box and hired somebody with the requisite, training and language skills. And that was it. This was before the National Council existed. It was before IMIA existed. This is a long time ago. And I am gratified for that experience because after a year of full-time interpreting at a level one trauma center, I went right back to graduate school and said, I need to learn more. I don't feel like I have adequate preparation to do the job at the level that I would want for me, for my family. So then I got my master's in bilingual education and I learned a lot more about training and how to teach better, and brought that back to the hospital to begin some provider training on how to partner with interpreters. And since then, the organizations that I mentioned, the National Council and the IMIA, have come into being and have created the standards of practice and code of ethics. And it is so heartwarming to me that many of the things that we secretly did turned out to be part of the standards. Um, there was a list at the hospital where I first interpreted of employees that had a second knowledge of a second language. And we were told when someone comes in that speaks Russian, Vietnamese, consult this list. That was it. That was it. There was no language service provider, no over the phone, certainly no video interpreting at that time. And I and my fellow interpreters decided we need to go and interview each one of these people and ask them, how good is your Polish? How good is your German? Are you comfortable interpreting about intimate parts of the body, particularly if it's a different gender than you are? And those questions had not been asked. They had just been asked to tick the box, do you speak another language? If so, what is it? And so that list got smaller because a lot of people, when confronted with the fact that they might be called to interpret, were like, oh no, I only know how to talk about food with my grandmother, or different things that heritage language speakers may share, and don't know the words for the body parts and systems, and or have a sensitive stomach. I don't want to be anywhere near the emergency room or if a patient gets sick. So, yeah, we tried to do those few things that we could to support quality of service provision and to have the patient get the best experience that they could. And even though what I did by switching off assigned assignments with my fellow colleague is not something I would recommend for staff interpreters to do today. At the time, it really was in the best interest of the patient because they weren't hiring people that they could guarantee were qualified, much less certified, in the language. It was a very surface kind of background check that was done, and there was no testing at the time. There was no telephone test to decide if your skills were up to par, and there were no certification tests at that time. Well, the first one we were talking about before we started this podcast, enjoying conversation with other human beings and being intellectually curious. I think if you have those two things, in addition to language, another language besides the one we're speaking right here and now, you have the foundation to develop with learning, with practice, with coaching, with feedback into an excellent interpreter. If you're not interested in other people, if you lack compassion, and most importantly, if you're not intellectually curious, you're never going to want to do the work that it takes to stay current, because you never get to a point where you can say, okay, I'm all done. I've learned all the terminology and I don't have to learn anything more. I can just park where I am and continue to deliver service. That'll work for the short term, but language is a living thing. It's not static. New words are added to the dictionary every year. And more importantly, new drugs are developed, new procedures exist, new machinery comes into the hospital, new diseases. Did we have a vocabulary for coronavirus before the pandemic? No, we did not, because we didn't have to deal with it before. So it is a continually evolving pursuit of knowledge. And we are never going to get to the end of this puzzle, so to speak. But if you enjoy learning, then this is a great situation, especially for people who get easily bored. You're never going to be bored as an interpreter, particularly if you get to see patients face to face. We're at a point where there is finally a proliferation of training available. And I have to also say that 40 hours is insufficient. If we want to have the respect of our fellow allied healthcare professionals that are on that provider team with us, we need to put in the hours. We need to have a path that in a consensus we agree upon, whether it's a 1-year certificate program. Personally, I would prefer an associate degree, a 2-year program, to prepare interpreters to be professional, certified, qualified healthcare interpreters. I'll give you an example. Electricians to be at the very basic level, plumbers to be at the very basic level to serve their apprenticeship with a master plumber or electrician, they have to put in 400 or 500 hours of training. And we're not dealing with pipes or wires or voltage. We're dealing with human beings with lives. My daughter, while she was in graduate school, taught yoga in order to work part-time while in graduate school. Her basic yoga training to get the initial certificate to allow her to be an instructor was 400 hours. She's a master level yoga instructor now. She's had over 1,200 hours of training, and this is for yoga, which I respect. But come on, interpreting in healthcare is something that could have a more profound impact on a patient's life, the family of that patient's lives. We need to up the standards. And I don't mean that we need to require this from everyone who's been certified. No, do it like we do with everything else. Grandfather in the people that are already there and start to push to increase the minimum number of hours of training required to take the national certification exams. And then hopefully there will be licensing, just like for nurses, just like for phlebotomists, just like for radiologists or any other technician in the hospital. We are the language expert. We are the language technician, so to speak. And we should be at parity with all those other professions in terms of basic requirements. Well, thanks for asking this question because really, when I was elected earlier this year in April, I said in my acceptance that my primary goal is to break out from the silos that we find ourselves confined in and find new groups and individuals to ally with, professionals in healthcare, educators in healthcare, educators in language, professionals in language. How about professionals in city services or delivering of services to limited English proficient or people whose language is other than English, LOTE, LOTE people coming into this country legally, immigrants, refugees, people who have been assigned and placed by the Red Cross. All cities and states have the challenge of trying to deliver services the best way possible, connect people to education, to jobs, to housing, to everything else. Why can't we have a meeting of all those different professions that interact with people for whom English is a challenge and work together, which gives me the opportunity to mention something called the Safe AI Task Force, which is exactly that. People in academia, people who work as language service providers, as interpreters, as translators, people who work in government, people who are lobbyists, people who work in tech. And I would particularly like to reach out more to folks working in tech, writing code, doing marketing for tech in order for us to have the conversation so that we can understand what are the standards, how do we uphold them, how do we help you uphold them. It's important to be at the table at the beginning and not at the end, which is how so often new innovations are introduced at the hospital. You language service department, interpreter services department gets called to the meeting when they unveil the new product. scheduling on Epic, whatever it is, and then you ask, where's the button to request an interpreter? And you get that blank look. And it's like, we need to be at the table at the start so that we don't create a problem by asking for a necessary item to uphold federal laws, state laws, because nobody thought to ask that at the beginning. So how do we do that? We have to reach out and make friends in other areas that we have not been as active in the past. And that's what I'd really like to see happen in the next year and a half that I'm in this position. Well, it's all bundled together. So if you're the kind of person that can do translation, do localization, do interpreting, work by doing voiceovers for AI and other language modules, you will have more opportunities to earn income. If you, because of your life situation and working remotely is a great way to handle children that are still in school, caring of older relatives that are may perhaps live with you, then you are limited to finding your own clients or working with language service companies that are increasingly buying each other out and becoming extraordinarily large entities, and that may or may not be as satisfying for you, but you can still do voiceovers um, and do recordings that you can submit from home to companies, gaming companies. You have to really be open to all the possibilities where language access is currently being developed, because language access is everywhere. People in this country, the United States, come from all over, and everyone needs to understand, whether you pull or push on this door to get in. And the opportunities can be boundless. Schools are finally waking up to the fact that they need an interpreter that is qualified or certified to be present at IEPs and other events, even something as simple as a PTA meeting, to meet local ordinances, city laws, and legislation that are increasingly being implemented and are often more rigorous than what is required at the federal level. So the opportunities are there, but they're not going to come to you. You have to join those Facebook groups. You have to get a profile on LinkedIn. You have to be part of a professional organization or two or three and attend those events and meet not only the people that work as interpreters or translators as you may, but other people in different job categories that are attending that same event, and ask them about the work that they do. There are all kinds of things associated with language access that fall outside simple interpretation or simple translation, but you have to kind of beat the bushes to find it. But they're there and they're growing. That's a good question. Yes, I did. Because when I went to college, when I was 19 and I arrived as a freshman at Brown University, I was fluent in English, but I had a little bit of Brazilian accent when I talk like this. And I noticed when I went shopping with another Portuguese speaking student who was from Mozambique, she had a lovely British accent. And the storekeepers would fall all over themselves. Oh, let me take your coat. Can I bring you a glass of water? And if I went shopping without Fernanda, the store detective would follow me around because I spoke English with an accent. So obviously I was there to steal something. And this all winds back to me going to see a play that my New York City born and raised roommate was in, and she had to be an Irish girl, an Irish lass. And she talked really tough from New York, like this. And I thought, oh my God, this is going to be embarrassing, but she's my roommate, she's my friend, I'm going to support her. And I went to the play and she spoke with an Irish accent, like I was looking for the tape recorder behind the curtain, like were they playing something and a different voice was coming out of her mouth? Like, how did she do that? And she's like, oh, I worked with, the drama teacher. He does voice coaching. And so it's a little bit like Pygmalion or My Fair Lady, in that you practice different sounds, ow, ow, e, or in English, the ones I had trouble with, I said girl as gal because the R, L ending, even the L way down here is not where we say it. All the Portuguese is in the front and in the sinus cavities in the front of the mouth. We move our face a lot more. And in English, there's so much more that's at the back of the mouth, the back of the throat, and deep down in here. So I had exercises like curl, girl, world, whirl, twirl. But it really took. Now, I enjoy music. I enjoy trying to learn different accents, etc. So I just took it on that way. But I had the guidance of somebody that knew what they were doing, who could identify which diphthongs and consonant clusters or vowel sounds I was having trouble with. The other one was the bird, word, not beard, weird, because my vowels don't have the sound. And then you spend 40 years in the country and it sticks. Well, generically, it's a beach, and more specifically, a beach with warm water. So that could be anywhere in the Caribbean or in Brazil. Yeah, we are very much a beach culture. You know the expression in English where you say when something is really, it's not bad, but it's not your preferred flavor or type of music, you say, oh, that's really not my cup of tea. It's different in every country. In Brazil, you say, that's not my beach. Thank you for inviting me. Thank you, Ginny. Thank you, Elena. And thank you, everyone listening. Go check out the offerings online that Leo has. There's some of the best training out there, some of the best experts consult and work with Ginny and the Leo team on a regular basis. If you want legal advice, Bruce Ailson is what I call the oracle of understanding how language access and legal issues intersect, plus so many subjects that you can do at a self-paced basis. So thanks for the invitation against Leo, and see you in December.